Heart disease is the #1 killer. It kills more people than all the cancers combined. So what do you do if you think you may have heart disease or you're diagnosed with heart disease? You go to your medical doctor and typically you're put on a statin drug. And we all know that there are side effects related to that statin drug, and not always does it work. As an anti-aging functional medicine specialist, I offer a test that really looks deeper down at your risk for heart disease and assess your risk for heart disease by looking really at your carotid artery itself. So what I do is a carotid intima media thickness test through the HeartSmart technology. This is a procedure that's performed with an ultrasound. It's completely painless. There are no side effects. And by analyzing your carotid artery, I am able to determine your risk for heart disease. So it's a way to really look at early on your risk for heart disease and then take a more proactive approach immediately to address that. So let me tell you how this procedure is done. It's about 15 minutes, and you're sitting in a chair, and I take an ultrasound wand and basically go up and down your neck, taking video imaging of your carotid artery. The analogy I like to tell people is look at a garden hose. Climb into the garden hose, and now look up. When you look up, touch the wall. That wall is the inner lining of your blood vessel wall. Heart disease actually begins there. So catching heart disease early by identifying if that wall is thickened is exactly what a carotid intima media thickness test does. And by assessing that, I could overall assess your risk for having heart disease or a stroke, which then allows me to take a more proactive approach. And that proactive approach may be optimizing your nutrition, optimizing your exercise, optimizing supplements. I may even need to refer you out to a cardiologist because things look really bad. So screening heart disease at this level has been shown to really identify your risk early and take a very proactive approach as opposed to waiting for you to have your first heart attack or stroke. So I really like looking at the carotid study called the CIMT, Carotid Intima Media Thickness Test, using the HeartSmart technology to really assess your risk and help prevent you from possibly having your first heart attack or stroke.